First of all, I must thank Dr. Manoj Chala sir and Dr. Purvi Chala ma'am for organizing such a beautiful conference at this place. So I'll talk about lifestyle as a prescription in diabetes, not exercise. It's not moving. So I'm not an authority on the lifestyle, and lifestyle is a controversial topic. And I'm not a six-packer. I'm also not an early starter. I've started late. If I can do it, I know everyone can do it in this hall. And lifestyle is for all, not only with the persons with a disease like obesity or hypertension or diabetes. So I'll talk about the basics of lifestyle. Lifestyle consists of 5 important things. One is nutrition, stress, behavior, sleep, physical activity. So you have to take care of everything. So prescription lifestyle, it's not like writing in a prescription, diet and exercise or 150 minutes of exercise per day, 5 days a week. For every patient, it has to go as individualized. And writing on diet and exercise will be like writing antibiotic and painkillers. So my dear friends, what is the most abused and addictive substance in the world? Food. Yeah, it's sugar. And when you talk about nutrition, so we must know what, how much and when to eat. And kitchen, the most diseases we get from the kitchen, and kitchen is the best pharmacy. Food is the most abused agent and exercise is the most underutilized antidepressant. And food is the only pleasurable substance which you can enjoy throughout the life, that is hedonic pleasure. The loved ones avoid poisoning them with the food. The more we love, the more we tend to feed. And we really need to eat for others' love or satisfaction. And we are what we eat. Exercise, of course, there are abundant evidence to back up the exercise. Exercise is very beneficial. Variety is the key. If you do only walking every day, I don't think we'll get benefit from that. But to keep on mix and match so that we get benefit from all the forms. Excess will not benefit. Again, this is controversial. The cardiovascular health and overall health are separate from fitness. And one can be marathon fit, mountain fit, or body fit. But is it really healthy? Is it metabolically healthy? That we'll find out. So what is exercise? Exercise is the subset of physical activity which is planned, structured and done repeatedly with a purpose. And somebody says that I walk a lot in my day-to-day life, that is active daily living. That is not exercise. What physical activity is the active daily living plus exercise. And an essential component of exercise is maintaining a good nutrition and sleep. And my dear friend, sitting is next smoking. So all this came from the American College of Sports Medicine, which says that similar to drug, exercise has to be prescribed in modality, dose, frequency, not only as a pathology but also a personalized patient approach. Every day we get all the WhatsApp on messages on the, sitting is new smoking or any moment better than none. But do we really get anything from that? Do we really follow that? No. Why? There's a big question mark. Basically, there are 2 types of exercise: aerobic and anaerobic. Aerobic. With aerobic exercise, oxygen supplies energy for the continuous movement. For example, like walking or swimming or dancing, or running. And anaerobic. In aerobic, the exercise that takes place without the oxygen and energy comes out from the muscle stores, like sprinting or bodybuilding or strength training. So these are few examples. Of course, yoga is a form of exercise which is very beneficial. We know that it helps in improving the flexibility, strength, posture, and the spine, and the bone health, muscle health, memory, good quality of life, good sleep, so on and so forth. So as I said, variety is the key. Not only running every day or going to gym every day, that helps. We have to mix and match. The strength, endurance, flexibility, and balance all are important. So concerns people of those exercise, they feel that they can eat everything and anything and everything, but that's not true. Or those who are lean, they feel that we need not do exercise. Or those into dieting, they feel that they don't need not do any exercise at all. But actually, exercise does not make up for the poor dietary habits, and we cannot outrun a poor diet. Don't ignore the warning signs. Suppose you are going for an exercise program or running a marathon or in the gym, and we feel a bit of chest discomfort. We feel that this will go. This happens and mind over the body. No, that's wrong. You feel anything during any exercise program, you should take a rest break and go to a doctor. So mind of the body, again rethink, compete with self. Anyway, we are not podium finishers. More of exercise is neither beneficial or harmful. As I said, it's controversial. And athlete's heart is always at a high risk of arrhythmia. So benefits of exercise are metabolism. Exercise places on energy demand on the skeletal muscles, utilization of glucose and fatty acids for generation of ATP, And both insulin and exercise increase the skeletal muscle input and increase the GLUT4. And exercise modulates post receptors insulin signaling, and exercise makes insulin resistant irrelevant. Utility of exercise, again, studies said afternoon exercise is more beneficial, like doing 2 to 5 is the best time, but I say to patient, whatever or whenever you want, you can do exercise morning, evening, night, even middle of the night, but exercising that is good enough. High intensity is more beneficial or effective than the lower, again, this controversies. Post-meal activity is more beneficial, particularly when meals are richer with carbohydrate, and resistance training is more effective in improving GLUT4 number and function. Benefits, it has got acute adaptation and chronic adaptation, but overall it reduces the aerobic capacity and increases insulin resistance, reduces insulin resistance, insulin secretion is increased, and as for the health is concerned, reduction in the diabetes, obesity, CAD, CVD, mental health, all these are improved. So if we talk about blood glucose monitoring for this particular for type 1 diabetic patients, ideally I advise them, or we should advise for the AGP or CGMs, and or else we can do AGT checking at least once in 30 minutes. That is in the initial part of somebody embarks on an exercise program. They should know like what sort of food, how much the blood glucose increases, or what exercise decreases how much of blood glucose. Once they know, the person knows, type 1 diabetic person knows that these the changes, then they can do it regularly without any checking. Avoid hypoglycemia, always carry some for particularly again type 1 diabetic patients or type 2 diabetic patients when they're going for marathons or long run, they should carry some glucose with them and decrease insulin dose during a previous exercise program, and should avoid insulin at the, like if you're doing a leg day, should avoid exercise taking insulin in the leg part. Fluids and electrolytes, again, sweating or thirst is a very poor indicator of the fluid loss. And sweating usually happens 0.5 to 1 liter per hour, but in hot and humid conditions, like a full marathon in Mumbai, we lose around 3 to 4 liters. So you have to be very careful with that. Good hydration can be achieved by drinking 400 to 600 ml of water before exercise, and we should ideally take small sips of water once in 10-15 minutes. And we should take due care for this electrolyte imbalance part while going for the exercise program. And again, intermittent sitting is a new form of exercise, and particularly for us or physicians, we should stand up or check BP for the patients manually by standing up, and that's also a new form of exercise. Particularly, all those are bench or job type. So RSI recommendations, they also recommend children and adolescents with type 1 and type 2 diabetes or pre-diabetes should engage at least 60 minutes per day or more of moderate to vigorous intensity aerobic activity with strength training exercise of at least 2 to 3 episodes or sessions per week with breaks. With alternate days. And adults with type 1, type 2 diabetes should exercise at least 150 minutes of exercise, moderate to vigorous intensity aerobic activity with at least no more than 2 consecutive days break. And shorter duration like HIIT, high intensity internal training, should be prescribed for those patients, those who are already into exercise program or those who are fit, and not for everybody, and decrease the amount of time spent in the sitting or sedentary behavior. Prolonged sitting should be interrupted, and flexible training like yoga, tai chi and pilates should be practiced with all this. So when you give exercise prescription, we should fit like whom and how we should give, whether the patient is fit for exercise or the patient is in a high risk or low risk. Again, you have to think of the mindset of the patient. Patient has got no intention at all. What is the intention? Some activity or already training. Somebody is not has no intention. We can at least request him to walk for 10 minutes and gradually increase for 10 to 15 to 20 minutes. And somebody is already training program. There goes a different prescription for exercise for this particular person. Gadgets and apps that really help. Gadgets like Garmin, Fitbit or Strava or Nike Adidas, they got different apps. They help us to know like what exercise are done yesterday or day for yesterday, and what we're going to do the next. They also help us to tell us about the sweating pattern, the fluid loss pattern, the sleep pattern, and the calorie we lose or the steps we do every day. And it has to be programmed, and there has to be a goal. Without goal, with the program, we cannot achieve. So these apps help us in reaching the goal. And basic tests we should do before any exercise program is KFT, RFT, all these things are required. So pre-prescription, when you prescribe somebody, you have to take something in mind, like be alert before prescribing exercise to the older adults with type 2 diabetes, persons with diabetic retinopathy, those who have NPD or PDR, you have to be careful with them, and persons with kidney disease, but for every disease there is particular exercise. Not that somebody, I've got osteoarthritis, I cannot walk or cannot do any exercise, or I've got a cancer, I cannot do exercise. For every disease, a specific form of exercise, and that has to be recommended. Okay, so how the exercise prescription goes, it goes on a FIT principle: frequency, intensity, time, and type. So frequency, like how frequently a person should exercise, like aerobic, like 3 to 7 days a week with no more than 2 consecutive days of rest. Resistance, minimum 2 to 3 sessions of resistance training exercise per week. Intensity, what should the intensity for, like moderate to vigorous intensity for aerobic exercise, and for resistance training or moderate resistance training, it should be like repetitions of 15 repetitions, which cannot be repeated more than 15 times. And for the vigorous training, like 6 to 8 repetitions of a particular muscle group, which cannot be repeated more than 6 to 8 times. And then comes frequency and time. How much time we should spend in the exercise? For aerobic, at least 150 minutes of workout in a week, at least 5 days a week. And resistance, at least 2 to 3 sessions, let's say 1 to 2 hours per week. And type, as I said, aerobic, anaerobic, and yoga, Pilates, and that is flexibility exercise. Tackling motivational inertias, all these exercise forms should be done in a group. If you do it alone, you'll get bored very frequently. So if you do in a group, somebody is there to push you. So WhatsApps and the message, there's always a formed a group so that we can push each other. Promoting exercise as a medicine, anticipating tackling barriers, records, gadgets, as I said, very helpful. Structuring and having goals is very important, otherwise we cannot achieve it. And addressing injuries and social media support is always there. So for injuries, you have to go slow and graded. It has to compete with self, not with others, and we were not podium finishers. Do not neglect the early signs and avoid self-treatment and diagnosis. And the prescription of exercise goes like this: you have to assess the patient, determine the priorities and health issues, identify patient capacity and intervention, and then goes for the frequency, intensity, time, and type. With that, we give a prescription, monitor the patient, educate them, and look at the behavioral changes. I just said, for every disease that is separate form of exercise, patients with a cancer or nervous system or metabolic system or urinary system, they have different form of exercise. And I must tell one thing, that we have forgotten about one pathogen we have moved from the ominous octet to datidurgens, but now we have forgotten about the sleep as important pathogens of type 2 diabetes. So 5 comments of healthy lifestyle is: love yourself, at least spend 1 hour a day for yourself. Nutrition, we must know how much, where, and when to eat. Fitness is exercise plus activity or daily living. Mindfulness, sleep, quality of sleep, reality, and family time, all are important. And self-discipline, that is, without that we cannot achieve anything. Timings and habits. Thank you so much.